We're going to do some upper rib testing, and with the ribs we're going to ask the patient to take his hand, put it behind his head and elevate the arm. I'm palpating right off of serratus anterior into the upper ribs, and I'm going to ask the patient at this point to elevate the arm and take a breath in as he's going into extension. I'm feeling for separation of the ribs. And then he exhales. And then come back up one more time, please. I'm looking for separation of the ribs in the upper segment. This is for the upper ribs. With the ribs in the upper segment, for lowering of the arm, we're going to have exhalation and slight flexion. So again, I'm palpating into the upper rib. I'm asking the patient to lower his arm as he exhales and goes into flexion, and I should feel approximation of those ribs. I compare both sides. As we go into the lower rib tests, the rib separation is with abduction and inhalation. So he's going to abduct his arm, and in the lower rib segment, I'm going to have him breathe in. Good. Then he's going to lower his arm, and he's going to exhale, and he's going to side bend into it. Good. I should feel approximation of the ribs with exhalation and thoracic side bending towards the opposite side. Okay? Specific rib test, we're going to use the index fingers, MCP, and we're going to come along into the rib cage. I'm going to start from, I can start all the way up into the upper segments, but in this case I'm going to start at about 7th rib. So it's going to come off the lower inferior border of the scapula. So my MCP is going to come along the spinous process, and right lateral to that I'm going to be on the chondral facet joint. And I'm going to basically do a ventral glide as I'm going down from each rib, testing specific ribs as we're going. Looking for spring. I'm going to compare both sides. How does it compare to the other side? So again, my hand position comes in here, find the spinous process, get lateral to it, get to the transverse process of where the rib is, where it's connecting, and do a ventral glide. As I'm doing it, to give them more stabilization, my hand should be ventrally against his sternum. Forgot that. No. Okay. Produces separation of the costal transverse joint.